Hello and welcome to my October Trust message. I'm sure you will join me in welcoming two new senior staff to the Trust. Our new chair, Anne Beasley, joins us on the 1st of October. Anne is a Kingston resident and a lifelong supporter of public services and has extensive experience of working at the highest levels of government. She brings a wealth of experience across a range of sectors which I think will help us steer the Trust towards its goal of becoming a CQC outstanding organisation. I know that some of you will have already met Anne during her induction on visits to services, and I also know that Anne is planning to visit many more teams and wards in the coming months. I would also, as well as welcoming Anne, like to thank Peter Molyneux for all the work he has done for the Trust over the last 8 years. Peter has played a pivotal role in the continuing success of the organisation. Through Peter's unrelenting focus on addressing some of the key underlying issues which can impact on mental health, including housing and employment, we've been able to take a whole systems approach to mental health and prevention. We really wish Peter good luck in his new role of the Chair of Sussex Partnership NHS Trust. I'm also very pleased that Sue Mckenna has now started in her role as Chief Operating Officer. This is a key role in the Trust, and Sue is responsible for managing all operational services across the Trust. She's very experienced in mental health and will provide us with some excellent leadership. I'd also like to thank Vanessa Ford for all the hard work she's done while covering this role until Sue was able to join us. Vanessa will now be able to concentrate on the programmes of work she has led on continuing to improve nursing and quality. Another area I'd like to talk to you about is the Trust strategy. Over the last year, we've been developing the new Trust strategy for the next 5 years, and I'd like to say a big thank you to all of you who've been involved in this work. It's been a very inclusive process involving staff, service users, carers, and our local stakeholders. The strategy provides us with clear direction for the next 5 years, and please will you take your time to have a look at this and share it with staff. It's on the intranet. There's a summary, and for those of you who are really interested, a more detailed version. We will be circulating more information this week and you can download your own copy. Now, there are two particular areas of the strategy that I do want to talk to you about, and these are making life better together and reducing inequalities. So making life better together, the Trust has long had as part of its mission. And whilst we've delivered significant change and development over our organisation and our services, we do recognise that we still need to do more to really turn this phrase into reality. We've looked at what staff have told us through the staff survey, and we know that there are more things that we can change. To this end, in 2018, we are launching Making Life Better Together. Now, this programme is different to how we've developed previous organisational wide programmes. It does not involve a top-down bureaucratic approach. It's not about targets or numbers. It's not even about saving money. Making Life Better Together is about working together to make the everyday changes that we know will help improve the lives of staff, service users, carers, and the community we serve. But Making Life Better Together has 3 streams around service users, carers, staff, and communities. That will each identify new areas, innovations, and developments that have been shared in parts of the Trust, or can be shared and scaled up, or external opportunities to improve and enhance the way we work and change the services we deliver. Making Life Better Together is based on collaboration and co-production, and will really be a vehicle for our organisational development. Now, there are lots of ways that we can make life better together. Some of this will be straightforward, like improving local clinical and working environments, or getting staff ideas heard by senior managers. Equally, some of it will take longer as we work to get the right culture in place by changing some of the things that staff indicate that the Trust has not been getting right. Making Life Better Together will provide all staff with an opportunity to put forward improvement ideas by a staff council and by the Trust senior leadership team. Now, as part of this programme, I've held a number of listening events with staff across the Trust throughout July. And almost 100 people attended the sessions that we had in Jubilee Health Centre, Tolworth Hospital and Springfield Hospital. And we had a really open and wide-ranging discussion on what works well, what needs to improve, and what actions we should take to address these issues. And the main themes that emerged from these conversations were really about the implementation of smarter ways of working, information and technology, and better support for staff with health and wellbeing initiatives. Whilst we're working through these now as part of making life better together, there are a number of quick wins that we've begun to implement. These include improving Wi-Fi connection, holding a smarter ways of working specific listening event to address concerns, and promoting staff benefits like the free gym and the global challenge that we run every year. Staff also felt that leadership visibility helped uplift morale, and a programme for senior leadership team going back to the floor will be launched later this year. A few more things I'd like to talk to you about, and the first one is the staff survey. Now, it really doesn't seem a year ago since I was last talking about the staff survey, but it is. And this year, the survey launches on the 8th of October and it runs until the 30th of November. And as you know, this is a national survey that we really encourage everyone across the NHS to take part in. So it's really important that you take part locally because we want to understand what is working well for you and what needs to continue to improve on. And this year we'll be making sure that we use every available way that we can to help you to complete this. And I'll make sure that staff come out to teams, to services, to discuss this with you and give you some time to complete it. So it really does help, so please make sure you complete this. Again, it is also this time of year when we celebrate World Mental Health Day. And for the last 5 years, every October, locally, we've been celebrating Mental Health Month and also Black History Month. And this is an opportunity to showcase the work that we're doing about promoting mental health awareness, challenging discrimination and stigma. And I know from talking to you that many of you are planning some form of celebration. So could you please let the comms team know these things that you've got planned by the end of the week so it can be included in the promotional material. So another seasonal thing is the flu. So I'll start that again. Also, the flu season is starting, so again, we must be prepared. We did really well again last year in terms of numbers of people that had the flu jab, and we want to make sure that we protect family, friends and patients. So please make sure you take up the free flu jabs. You'll be seeing and hearing a lot more about this in the coming months, and the clinic dates will be on Insight starting on the 1st of October. And last, but certainly not least, I'd like to talk to you about the Quality Awards. So as part of Making Life Better Together programme, the Quality Awards will be taking place on the 29th of November. And for those of you who were at last year's awards, you'll remember it was great fun and it was a real opportunity to celebrate the successes across the whole organisation. The nominations are now live and you can do this by going on Insight. So please get nominating. There are some fantastic staff out there and we really want to make sure that we get as many people as possible included and shortlisted this year. So you'll hear a lot more from Ranjit shortly about this and as they details on Insight. Thank you very much for watching. As ever, if you have any questions that you want to ask, please email me or contact me directly. Thank you.